The next class is again a class on bone and joints. So these are my references, and obviously these are questions. Osteogenic sarcoma, it has been asked at least about 40 to 50 times in all university questions. Important in surgery as well as orthopedics also. Chondrosarcoma, strangely it has been asked, so we will be reading a little bit about that also. Coming to osteosarcoma, what can be the causes of osteosarcoma? Any of the disease, as I told you, what is the age, what are the bones that are being involved, what can be the causes. For example, radiation can be a cause for it, or that can be because of an infection, or that can be because of some predisposing conditions. Retinoblastoma gene is associated with osteogenic sarcoma. There are all these things which I have explained. I would like you people to go through. Next, the gross picture. You find it is a very aggressive tumor. It will be destroying the cortex and there will be an elevation of it. You get a triangular appearance called the Codman's triangle. And microscopically, you will be finding new bone formation, osteogenic sarcoma. So that will be important for us. We'll have to mention it. And histologically, there are a lot of variants. Robbins also would have given. There is osteogenic differentiation, chondrogenic differentiation, fibroblastic differentiation. And there are some other variants also, like telangiectatic, which we will have to remember and write. Paget's disease, it can come as a short note at the most. There are 3 stages of it. It is called as metabolic matrix madness, given beautifully. So there can be an osteolytic and then an osteoblastic, then finally osteosclerotic stages. This I would like you people to kindly remember. What are the bones that can be involved? What can be the symptoms, the pressure effects? All can be mentioned very briefly. Osteomyelitis I have already covered in general pathology, and you people, students were actually very good in answering. They were mentioning pyogenic osteomyelitis and then chronic osteomyelitis. All the etiologies, including tuberculosis, typhoid, can be mentioned. Brody's abscess is supposed to be classical of a chronic osteomyelitis. How it spreads, what can be the predisposing conditions? I have given a list of it, and what is the mechanism? Ultimately, there is a draining sinus and there is a discharge of bony chips. Others, mainly rheumatoid arthritis. Rheumatoid arthritis is an important question, difficult to answer again. It comes under autoimmune diseases, and I've explained it beautifully in a separate chapter. So there can be a crippling disease with a swan neck like deformity of the digits. And mainly you find it is an antigen antibody reaction. There will be a destruction of the joint spaces. There will be a deposition of a substance called as PANAS. This you'll have to mention, and the inflammation can be because of lymphocytes or lymphoid follicles. So this you'll have to explain in detail. What can be the other diseases associated with it? SLE, for example, can be associated. Other autoimmune diseases. We'll have to make a mention of it. It is a difficult question, but not if you read. So, this is a thing. A summary from my class itself. I would like you people to kindly go to my class. Genetic, constitutional, radiation, environmental, radium dial painters. I would explain all this in my class. This lady paints the watch and then she touches the bristles with her saliva so as to make it pointed. Because of this, she develops an osteogenic sarcoma. Whenever there is an increased growth, you find, as in Saint Bernard, that's a dog, that can be an osteogenic sarcoma. That brings us to the end of this class. Thank you.